Hello, everyone. Hello. Hi, I'm coming back today to talk about nursing. Where are all my nurses? Let's talk. Let's talk, all my nurses. Today, I want to talk about managing your anger. Managing your anger as a nurse. Being patient as a nurse with your patients. So, as a nurse, at the beginning of your shift, once you clock in and go to your floor, what happened? What happened? You have to be at the huddle. The huddle is where the previous shift, maybe let's say you're working day shift, you come in the morning, the charge nurse for the previous shift would outline, what really happened the previous night, if any event, anything occurred that they need us to know, that they need the day shift to know to pay attention, how many patients that are on isolations that the coming shift needs to know what kind of isolations, patients that are on like a life sitter, that somebody has to sit with that patient for safety to make sure they don't fall. Sometimes some patients come in with confusion. So those are some of the things that they talk at the huddle, which is very important to be at the huddle. And sometimes some things regarding the policies of doing certain things, the policies of the hospital or the facility can be reinstated, or can be enforced, just so everybody can be on the same page on a certain procedure on doing certain things. So that being said, that's when you get your assignment. You get your assignment, the number of patients you have for that day. Then you go meet the previous nurse. You have to go to the room of those patients with the outgoing nurse and get a report right there in. Make sure you get your report in the room with the patient. The nurse that is going out giving you a report has to be with you in that patient's room and give you a thorough report about that patient, why the patient came in, how the patient is doing, what's the plan of care for this patient, what you need to do for that patient, things that are pending that are not yet done for this patient that you need to carry on. And then you doing your assessment with that nurse in that room on that patient to know the cognition of that patient, orientation of that patient, see if your patient is breathing right. If your patient is in distress, you speak to your patient, check your lines if the lines are infiltrated, if they are not. So those are the things you have to check with the outgoing nurse. Take a thorough report at the bedside. Make sure you do that, especially my new nurses. Don't just get comfortable and don't go to the room with the outgoing nurse to take a thorough report. You must do a bedside report. It's very important. So after taking your report from all the patients, then uh, that's when your nursing prioritization comes in. You have to prioritize what patient you can start with, what patients need pain medications right away. There are some patients that are more demanding than other patients, their situations are different. During your shift you're going to have situations coming up, some urgent situations coming up, so you're going to work according to how those things are coming up. Never get frustrated to your patient, or never go to a patient that is calling you at any time, or calling you for pain medication when their medication time for their pain medication is not due. You still have to be patient with these patients and talk to them politely, talk nicely, watch your body language. When somebody is sick, that person is in pain, the person don't have no patience with you. So you have to be patient, you have to talk nicely, watch your body language, watch your tone. If your patient call, don't just walk in that room and say, what do you want? No, you don't talk to somebody that is not feeling well. They are there for a reason. You have to talk nicely. How may I help you? You listen to what they say. If it's that is too close for you to give their pain medication, you can say, okay, let me see what time I gave you the medication. Then you tell the patient the time you gave the medication, and how many hours you're supposed to give the next dose for that medication. You explain it to the patient, and then you tell the patient, you look, let me get to the doctor. Maybe the doctor may decide to give you a one-time dose for your pain at this time. Okay, so you have to look ways to work with your patient. So I think this is good for the stats of my video, and watch out for part 2 of to know some of the things that as a nurse you do on the floor. And nurses, don't forget to document everything you do for your patient, everything you do for that day. Document, because if you didn't do it, it wasn't documented. If you give your narcotics, you pull your narcotics, you must make sure you document. You pull medication, you make sure you scan it in that patient's room for that patient. If the patient did not take the medication, you documented waste. So you have to be in, you know, you have to focus, keep those things straight. You have to document everything. So it's a lot to discuss about what the nurse do for the day. And you know, for the next video I will talk about things that you do, like your IV lines. Check your IV lines. If you see that the line is leaking, just take it out. Some of those things are things, you know, situations that you can avoid. Don't let it, if you leave a line that is leaking, the next 1-2 days it may get infected. So you must be a thoroughness and almost always document what you do. Always document. Communicate with your doctors. Check your messages frequently. Implement all orders that the doctors are sending in. Any request that the doctor is requesting, do it. If you see any order that you are not clear, get back to the doctor for clarification. Talk with your doctor and clarify those things. You work under the control of the doctor, you work under the direction and orders of the doctor. So implement those orders on time as they come in. Do your stat labs as they come in, and communicate with the doctor if anything wasn't done. And you know, focus. That's what it is about. It's a lot going on in nursing. During you are on your shift, but you have to focus and make sure you don't miss anything. So put questions. If you have any questions, I'll come back to this video, I'll answer their questions, and for the next video. And I'll think I'll have to plan very well things that I can discuss, especially if you are a new nurse coming to the floor, what you expect and what you can do to better help your patients. Thank you for listening. Thank you for watching. Please like and comment.